Hello, my name is Dr. Alexander Kumer from the Veterinary Channel. This presentation will discuss the differential diagnosis and diagnostic tests for the clinical signs of excessive thirst and excessive urination. After this presentation, we encourage the veterinary student to get familiar with the following terms: polydipsia, polyuria, diabetes mellitus, diabetes insipidus, low-dose dexamethasone test, a CTH stimulation test, medullary washout, and psychogenic polydipsia. Increased thirst and urination can take two primary forms. In one, a pet excretes enormous amounts of dilute urine and then consumes excessive amounts of water to compensate for the water lost in the urine. In the second type, a pet consumes excessive water and must pass considerable dilute urine to eliminate the surplus water. Increased thirst and urination have been linked to many different disorders. The more prevalent conditions are renal diseases such as kidney failure and infection, and pyonetra, a condition of the uterus in females. Hormone imbalances include hyperadrenocorticism, hypercalcemia and hypoadrenocorticism, hyperthyroidism, diabetes mellitus, and diabetes insipidus. Certain types of cancer, liver illness, certain medications, and certain types of electrolyte imbalance can also induce excessive thirst. Some behavior conditions can cause primary polydipsia or psychogenic thirst. The investigation of possible causes begins with a thorough history and physical examination. The history of a pet refers to the information you provide the doctor on your pet's sickness. The patient's history is critical because it can reveal crucial information regarding the source of excessive thirst and urine. For instance, a female pet who was in heat 6 months ago may have increased thirst and urine due to an infected uterus. A pet that is eating well but losing weight may have diabetes mellitus. Certain medications may result in increased thirst and urine. As a result, the veterinarian should be informed of any medications or supplements the patient takes, including anti-seizure drugs, corticosteroids, and diuretics. Additionally, it would be beneficial if the owner recorded how much water the dog drinks in 24 hours. This will assist your physician in determining the severity of the condition. Physical examinations are comprehensive and often include listening to the heart and lungs using a stethoscope and palpating the abdomen. In addition, a physical exam may reveal information about what is causing increased thirst and urination. A dog with small rough kidneys, for example, may have a severe renal disease. A dog with a sagging tummy and hair loss may have Cushing's disease, and a dog with enlarged lymph nodes may have lymphoma. While a thorough patient's history and physical examination are necessary first steps, additional testing will almost certainly be required, and your veterinarian may propose screening tests. These straightforward tests provide valuable information about your pet's overall health and frequently illuminate the underlying problem. A complete blood count, a serum biochemistry profile, and a urinalysis are the most often used screening tests. What information can we glean from these screening tests? Along with elucidating the likely source of your pet's symptoms, these screening tests may reveal other diseases that require attention or treatment. The complete blood count identifies the 3 distinct cell types found in the blood. The erythrocytes transport oxygen to the tissues, while white blood cells fight infection and respond to inflammation. Platelets aid in blood clotting. The complete blood count identifies aberrant cells and offers information about the various cell types' quantity, size, and shape. The complete blood count may reveal alterations, such as the following in a pet experiencing excessive thirst and urination. An intact female's increased white blood cell count may suggest pyonetra or hyperadrenocorticism in dogs. High numbers of specific white blood cells, eosinophils, and lymphocytes may mean hypoadrenocorticism. Aberrant white blood cells, which may indicate lymphoma, are a type of cancer. Serum biochemistry is the study of the chemical composition of serum, which is the pale yellow liquid that remains after cells and clotting components are eliminated. Enzymes, proteins, lipids, carbohydrates, hormones, electrolytes, and metabolic waste products are all serum. Testing for these compounds reveals information on the health of the body's numerous organs and tissues, as well as the animal's metabolic state. When a pet's thirst and urination are elevated, the serum biochemistry panel may reveal some of the following changes. Increased liver enzyme levels in dogs may suggest liver illness or hyperadrenocorticism. Elevated urea and creatinine levels, which are typically indicative of renal disease. A blood glucose level that is too high is an indication of diabetes mellitus. Low urea levels may indicate severe liver disease or a condition known as medullary washout, which is occasionally seen in pets with chronically excessive thirst and urine. Medullary washout is a mild condition that can be reversed if the increased thirst and urination subside. Elevated electrolyte levels are indicative of hypoadrenocorticism. Urinalysis is a straightforward test that determines urine's physical and chemical content. It assesses the kidney's function, detects inflammation and infection in the urine system, and aids in detecting diabetes and other metabolic disorders. Urinalysis is critical for correctly interpreting the serum biochemistry profile and should be performed concurrently with blood testing. Some of the changes detected on urinalysis in a dog with increased thirst and urination may include the following. The low specific gravity of the urine indicates that the urine is thin or watery, meaning that the pet is likely passing more urine. If kidney values are increased concurrently, renal disease is almost certainly present. Serum kidney parameters, particularly urea, may be abnormally low, indicating severe liver disease, medullary washout, or diabetes insipidus. The presence of glucose is a symptom of diabetes. There are two types of blood cells: red blood cells and white blood cells. These symptoms are suggestive of infection and inflammation. They are associated with kidney illness, urinary tract infection, and malignancy. Depending on the information provided by the history, physical examination, and screening tests, the veterinarian may propose additional tests. Several examples include the following. Thyroid hormone levels, to determine if the thyroid is working correctly. Fructosamine. If diabetes mellitus is suspected, the veterinarian may measure serum fructosamine levels to confirm the diagnosis and create a baseline for treatment monitoring. An intact female dog pyometra, X-rays, and ultrasound would be recommended to diagnose. Calcium testing. An elevated calcium level in the bloodstream may be associated with increased thirst and urine. Adrenal dysfunction testing. For instance, a CTH stimulation test can be used to diagnose Addison's illness, whereas a low-dose dexamethasone test can be used to diagnose Cushing's disease. Diagnostic testing to determine whether the liver or kidneys are failing. These may include functional examinations, X-rays, ultrasounds, and biopsies. What if the underlying reason for increased thirst and urination is never identified? If all screening tests are negative and the pet continues to pass diluted urine, testing for diabetes insipidus should be considered. This concludes this presentation. Remember that you can help us train future veterinarians by giving us a like and subscribing to our channel.